Okay, you will see me trying. Oh, now we're live.
Hi there.
Great. It is Monday, August 24th, 2020, and I am delighted to introduce all of you to Dr. Sruti March.
Hi
Dr.
there.
March is a naturopathic doctor, having received her degree from Bastyr, is that correct?
Bastyr.
Bastyr University in San Diego. And she has an undergraduate degree in bioengineering from the University of California, San Diego, which she said has really helped her. Um, And I'm going to let you explain the link between your bioengineering degree and your naturopathic degree. And then we're going to
Yes.
go right in to some questions around the benefits of sleep and exercise to help breast cancer patients, but also
Mhm.
to help prevent occurrence of breast cancer and recurrence of breast cancer.
Yes. So, hi there. I'm Dr. March, as Molly so lovely introduced me. I'm a natural medicine doctor and I specialize in oncology nutrition. So, what I like to say is that I look at your body like a garden, like just like we have shrubs, trees, and hopefully some flowers in your body. Our body also has structures like liver, lungs, kidneys, our hearts, right? So, when I'm looking at your garden, for example, when we have a weed like cancer,
Yeah.
medical oncology, radiation oncology, surgical oncology is super good at cutting out that weed, giving chemotherapy to the weed, radiating the weed, right? But my job, Molly, is to look at your body as a whole, your garden as a whole, and ask what's going on with the soil? Are there nutrient deficiencies? Are there things that we could be giving the soil to make the garden grow better? Or is there something up with the atmosphere? How much sun, vitamin D, how much stress in our lives are we enduring so that we can make the garden grow really well?
So I'm going to raise my hand so that you know I want to talk so I don't interrupt you. But
Okay.
as you said about the garden, I was thinking about my garden and the chemical known as Roundup.
Mm-hmm.
And that chemotherapy is a toxin. It kills cancer, but it can harm other parts of our body. So
That's right.
that is why nutrition during and post treatment is so important to rebuilding that that healthy garden so that we don't have the weeds
Yes.
and we're not having to use toxins to get rid of them.
100%. I love that you said that. So, supporting the cancer patient throughout treatment to make sure they can tolerate treatment so that they do well through surgery, so that they recover faster is one facet of what I do. And the other part of what I do is I help people figure out how to use their forks in their fight after cancer, so in survivorship. And so much of that, Molly, is not just using what's on our fork, but some of the other things that you and I wanted to talk about today, which is how do we keep your garden healthy by utilizing exercise and sleep, particularly as it relates to cancer.
Okay, let's hear. You want to start with sleep or exercise?
How about we start with sleep?
Okay.
So, you first want to talk about what is high quality sleep and how does it play a role in breast cancer growth? So let's talk about what good quality sleep is first. There is something called the National Sleep Foundation, and they've done lots of studies and basically found out that there's four-ish qualities that tell us, are we having good sleep or not? The first one is time in bed. So for as long as you're in bed, they want to make sure that you are sleeping at least 85% of the time. Okay. So number two, when we fall asleep, Molly, and I can't see you here for a second, when we fall asleep or when we lay down, they want us to be able to fall asleep within 30 minutes of hitting the sheets. The
That's easy
third,
for me.
oh, good. Um, the third thing is if you're waking up, that you only wake up once a night. And the fourth thing is if you do wake up, being able to fall back asleep within 20 minutes. So now I'm
Um,
sure, go ahead.
well, that's the hard part. I think for me, sometimes if I wake up between 3 and 4
Mhm,
a.m., I lay there and I think, should I go make a cup of tea, like nighty
mhm.
night herbal tea?
Yes.
Um, the other night I woke up at 4 a.m. and what came into my mind is I want a beer. I'm like, a beer at
A
4
beer.
a.m.
Yeah.
Did I
Right.
want carbonation? Should I have had a Pellegrino? But I finally did get up and have some
Hmm.
Pellegrino.
Yeah.
back to sleep. But I, I typically only wake up once a night, if that.
Yes. So that it falls in the good quality sleep. And if the nights that you're waking up and not wanting or wanting beer are not the norm, right? And they're the exception to the rule, then you'd qualify for that good quality sleep. But
I don't
you
even
and
like
I,
beer.
you and I were kind of offline talking about getting a nightcap, right? And so much of us, so many of us are using alcohol nightcaps really since the pandemic hit. I think alcohol sales were up 40% or something the last time I
Mhm.
checked. So, one of the things I do, whether somebody is struggling with staying asleep or with just falling asleep in the beginning, we might try something like a bit of a protein snack. So, sometimes something like a single non sugared yogurt might do it, like a Greek yogurt. Something like 12 almonds is oftentimes enough to prevent that midnight waking and inability to fall asleep. And the last is something called golden milk tea. That is a concoction. I usually use a plant based milk, so something like almond or a flax milk. Or boxed coconut milk, and putting in a little bit of turmeric, which is the stinky yellow spice that people from India like me know so well. The combination of that with a little bit of honey can really just create that warm, full belly sensation that we like to help people fall asleep or even stay asleep if we need to.
So when I was doing that with the turmeric, I
Uh-huh.
found that the turmeric would clump on the
Mm.
surface of the milk. Do you have a solution for that?
Yeah, so I use a whisk. Just whisking it in just a little bit. One of the other things I often have people switch over to if they like green tea is matcha. So just like it uses a whisk, it really helps break up the clumps of turmeric and really can be a beautiful drink.
Okay. So maybe a cup of almond milk mixed in with how many
A
tablespoons?
teaspoon, like to start, I might even start with half a teaspoon and just use a little honey as people are working up to the taste of it. I like to add a little bit of pumpkin spice mix to it because it one allows me to cut down on the amount of sweetener. It really gives those like warming sensations more in the winter than I want in the summer, but that can really create that nice full feeling and help people go to sleep.
Okay, so just to reiterate,
Yeah,
in lieu of an alcohol beverage,
yeah,
a nightcap of almond milk with turmeric, honey,
yeah,
maybe a little cinnamon or pumpkin spice, and or maybe 12 almonds to build up your protein levels
yeah.
so that you don't have your blood sugar drop and wake up in the middle of the night.
Yes, exactly. So those are perfect ways to do it. But let's get back to talking about how sleep can, or how much sleep, because we didn't cover that, right? So for people that are under 65, there is no exact magic number. We've heard 8 hours, right? But really between 7 and 9 hours, and adjusting that to your own energy levels is important, right? So it's not just sleeping, being in bed for 9 hours. It's really getting that good quality sleep, not waking up too frequently, like we were talking about, and also feeling rested when you wake up. So, a big piece of when I sit down with patients is to get a full history on them. I ask really in depth sleep history because it can give me clues. So, for example, I'll say, what time do you go to bed? How long does it take you to fall asleep? Do you wake up in the middle of the night? Does your mind start racing when you wake up? Is it always to pee? When you wake up in the morning, do you feel like, Energizer bunny, you're ready to hit the ground running? Or are you just cannot wait to run over and get a cup of coffee kind of feeling, right? Those are all clues to me as to what may be going on. So, Molly, you mentioned that blood sugar can be one of the underlying reasons we wake up, but so can anxiety and depression, right? So, you had mentioned this need for a beer, wanting a beer, and that might just be a one off where you're desiring that. But alcohol, the reason we enjoy it is because it drops our sensations of alertness, right, by releasing
Mm.
GABA. And that's one of those relaxation chemicals. So if that's happening more frequently, Molly, so I might say something like, I might do a little quick hit on anxiety, depression. We may try using like a blood sugar snack, like I mentioned, or some other types of sleep support to really give you those restorative hours that are imperative, whether you're fighting cancer or you're in survivorship.
So I know that it's recommended that you also have your sleep time the same time every night, like go to bed at the same time. This afternoon I took a nap, which I've been doing lately, which is not good for your sleep time because you change up your rhythm.
Yeah.
Talk a little bit about rest while in treatment when you might feel like you need extra resting time during the day.
Yeah, so that's a great question. So Molly wants to know, when you're feeling really tired in treatment, should I nap? Because I heard napping isn't so good for me, right? And my answer to that is they've done some studies that are showing that napping during chemotherapy does not throw off somebody's circadian rhythms, which is what you're talking about, getting up and sleeping at the same time. And it's not true that all napping throws off your circadian rhythms or your sleep and wake times. Sleep is developed by pressure, right? We call it sleep pressure. It's that, sometimes when you're feeling so tired and you close your eyes for 2 minutes and all of a sudden you're more refreshed, right? It's because we have that buildup of pressure. And even if you sleep for a little bit, sometimes it releases that. But if you're the type of person that wakes up and you're more groggy than you were when you went to bed, we either have to adjust those nap times, like maybe do 15 minutes or 20 minutes rather than 45. And that might help you not feel quite so groggy and still get the rest that you need.
So I would think that it might be prudent then to maybe set an alarm on your phone. Like if you feel you really need to lay down, set it for maybe 15 minutes. And then if you wake up and you feel, I just need a little more, you add another 5 and then get up.
And see if it's affecting your nighttime sleep, right? Okay. If you're able to do that and it helps you get through treatment, make sure you're still sleeping at the right time and not at 2 a.m. or 12, then it's the perfect nap to take.
So what else about sleep would you like to share with us?
I think probably the only thing that's worth mentioning is how sleep affects us in terms of breast cancer growth. So how we sleep is we have a hormone called melatonin that's secreted from our brain. It happens as the sun starts to set and we're not exposed to as many lights. Our brain is supposed to increase melatonin to create that sleep pressure that I was talking about, right? So as melatonin gets high, that's when we're like, oh, I'm really feeling sleepy here, right? But so many of us are now exposed to artificial lights, right? Because thank goodness we have the gift of electricity, right? And most of us kind of fall asleep watching TV or those kinds of things. And we know that that affects our internal melatonin production. Why do we care about melatonin production? The reason is because when melatonin is low, estrogen levels tend to be higher.
Oh.
Right? Yeah, so there's an inverse correlation there. And there's still, we're still trying to figure out, even after all the science advances that we have in science, to really understand exactly all the different ways that sleep helps us. But that's just one of the ways. Go ahead.
So estrogen is a huge feeder of breast cancer. What percentage of breast cancers are estrogen positive?
The majority are. Right?
Like 70, 80%?
Yeah. Yes. So triple negative, it just depends on somebody's race, right? So if somebody is white or black, for example, all of those will alter the percentages, right? But
Does sleep have anything to do with progesterone?
Not so much, at least not in the research that I've seen, right? Okay. So like I was saying, Molly, we only understand really probably the tip of the iceberg when it comes to the advanced chemical signaling that happens with sleep, right? Particularly because we don't know why people aren't sleeping. Is it because they have underlying anxiety, depression? Is it because, they're addicted to Netflix, like most of us are, or use it as a time to unwind or other things like that? Mm-hmm. Right? So the other thing I wanted to mention, Molly, is that when we don't sleep, it affects a lot of the ways our body uses fat and sugar or our metabolism. We don't 100% know why, but sleep alters our ability to stay full, right? So basically, our body wants to eat more, and like poor sleep is correlated with an increased body weight. right? And we know that obesity or an increased body weight is a known risk factor for breast cancer, for heart disease, for diabetes, which is really the top three, problems that we have as women.
So, what do you suggest we do about weight and sleep? I
Totally.
know that
So
there are some studies that say don't eat anything after 7 p.m. or fast.
yes. So this is a beautiful topic, and I want to spend probably 2 hours talking with you about exactly what to do with nutrition, right? But I want to take a little moment here to talk about the importance of individualization, right? So when we say fasting is right for everybody, well, one, that's not true, right? And two, so much of it has to do with your personal preferences, what your labs say your thyroid is like, your metabolism is like, right? So I always sit down with somebody and spend 60 to 80 minutes getting to know them, getting to know you. What makes you tick? Do you have a history of depression, diabetes, heart disease, high blood pressure? Did you struggle with treatment? What's going on with you now? Like, are you feeling financial pressure, something that you talk about so frequently? Are you in the middle of a divorce, tough marriage, estranged kids? Like, all of these factors, of course, affect our whole garden and affect how we can make changes in nutrition, affect how we can make changes in exercise, right? So that's why I usually work with an interdisciplinary team. So I work with everybody's doctor so that I'm not saying something that isn't aligned for you, the patient.
Mm-hmm.
Yeah.
So, you have that would require really having an appointment, which
Yep.
basically you're here in Michigan. Do you do
Mm-hmm.
anything by telehealth with people outside the state?
I do. So I act as a consultant. So I always say I let medical oncology, primary care kind of uh, head some of that goal for you, right? So I'm the person to talk to if you want to know, how do I manage all this misinformation about nutrition? Or, one of the things I was going to say is there is like some magic numbers when it comes to exercise, right? And we can go over that in just 1 second.
Mm-hmm.
But my goal is to make it so that it's doable for you, right? It's not a one and likely done, because information is just the tip of the iceberg. Then we have to go and actually not eat lots of ice cream whenever we want to, or you know what I mean? Like, make it so that it's reasonable for you. Got to have some ice cream, right? Because I don't want to live in a world without any ice cream, right? Or the occasional alcohol, like that's all based on your personal preference. So what I do is I still see people over telehealth, but in that realm, I act as a consultant, right? I say, hey, let's use these 3 strategies, right? And I may give them specific directions to what to talk to their oncologist about or their primary care person about.
So, if somebody wanted to use you in a telehealth
Mm-hmm.
consultation, would they be able to send their blood labs to you things ahead of time so that you could specifically discuss their metabolic rate and
Of course.
okay.
Yes. So when I sit down with somebody, Molly, when I'm spending the time getting to know them, I'm listening for, have you had any issues losing weight in the past? That kind of thing. And it'll cue me to say, oh, order these labs or look at these specific labs, right?
Mm-hmm.
So then when, whatever state they're in, I'll have them work with their doctors to get those labs drawn. And I will marry whatever I heard from the patient in the visit along with those labs to make recommendations for them, right? So that might include things like thyroid, et cetera. But
Mm-hmm.
so much of it is just lifestyle based, right? So much of it that's easy to do. It's simple, not always easy, right? But we make it so that it's step 1, step 2, step 3. Otherwise, whenever somebody's, newly at a treatment, they want to do everything, right? They want to change their diet, exercise right away, quit everything. And it really doesn't have the lasting longevity that we're looking for in thrivership.
Mm-hmm. Plus, I think that people feel when they do that all at once that they're losing things that they enjoyed.
Yes.
Like you said, it's a type of a step therapy. So
Yep.
let's talk a little bit about that benefit of exercise and
Yep.
how exercise impacts sleep as well, and maybe an optimum time for exercise as well as making it a ritual and a routine.
Yes. So, with exercise, I mentioned this magic number. So, I first want to talk about why exercise is beneficial, right? So, the National Cancer Institute says that exercise for 30 minutes, 5 days a week. So, that's 150 minutes
Hmm.
of moderate intense, or 75 minutes of vigorous activity improves anxiety, depression, quality of life, fatigue, and overall survival. Exercise is one of those things that we know can impact the risk of recurrence, right? So the question is when and how and all these things, right? So I say, let's talk to the person. Do you have peripheral neuropathy? Do you have resultant lymphadenopathy from surgery, radiation, etc.? Do you have other cardiac risk factors, right? And then I get to know you, Molly. I say, what kind of exercise do you like to do? Do you hate exercise? Because I don't have a magic wand. I can't make you love exercise, right? But I can work with you because I used to be a California girl, right? And I tell people all the time, I say, I know you love walking outside, but I have bad news for you. We live in Michigan, right? Or we live where there's snow for 5 months of the year. So we come up with a team-based approach on how you approach exercise. Like how much, are you the type of person that should start with aerobic activity, like walking, maybe some swimming, that kind of thing, to just get your heart rate up, to get the benefits of the mood lifting properties of exercise first, right? Um, and in terms of optimalness, there are lots of people think that working out earlier in the day helps them with clarity, etc., like setting the tone in their day. But I also have a big cohort of patients that wipes them out, right? So I I know I've been emphasizing individualization, but there really is no other way to work around it when we're thinking about people's work schedule. Are they, maybe morning is a hellish time for them with kids drop off or whatever they've got going on. Or if somebody has mid-afternoon real bad fatigue, and if it's nice out, I'll have them actually take a small break in the middle of the day to do a quick vigorous walk for say 15 minutes. And that not only gives them a little bit of energy, which helps them get more of their work done, right? But it kind of breaks up the day, and it helps get that little bit of exercise in.
So when our team was all in the office for a period
Mm-hmm.
of time, we would take a 3 o'clock break and
Yes.
go out as a team and walk for 30 minutes, cross this busy road into this subdivision and walk for 30 minutes and come back. So
Isn't it
that
great?
it worked out really well. People looked forward to it. Then when we returned, we would have a cup of tea,
Yeah.
preferably herbal tea, and then go back to work. But now with COVID, so my favorite thing is to swim laps, and I can't do that now
Yes.
because the pool that I
Mm-hmm.
go to is closed.
Yes.
So with COVID, that really has restricted a lot of it to running, walking.
Mm-hmm.
If you have peripheral neuropathy, that's not going to work for you. What
Yes.
about a stationary bike?
Yes, of course. So any sort of aerobic activity is
Uh-huh.
perfect. So what I mean by that is, good old fashioned, oh my gosh, I'm forgetting his name, Richard Simmons tapes. No, I'm just kidding. Or,
Yeah,
more modern ones. I know a lot of the cancer centers around here are doing virtual classes. So doing things like that has been really helpful for my patients, chair yoga, etc. And a stationary bike is fantastic, but good luck ordering one, Molly.
I know. No, they're
Those
not.
things are on major back order.
Right, they're not available. But
Yeah.
the other thing that I used for a while was a mini trampoline until
Yep.
I sprained my ankle.
Oh
So
no.
I guess I was too vigorous in jumping. But that's
Yes.
another great thing. Can you talk about that in terms of the lymph system and how that moves fluid?
Yeah. So jumping, well, first of all, if you haven't gotten on a trampoline, first check with your doctor. But if you have, trampolines use so many of your major muscles that they're actually an excellent workout. Um, I don't know. There's now like big trampoline gyms, but they're obviously closed for COVID. They're a fantastic way to get your heart rate up and use those big leg muscles, your glute muscles, your butt muscles, and so much else. And Molly's talking about the movement of something called lymphatics, right? So the lymphatic system, you guys are very familiar with lymph nodes. They're like your immune cell stations. And a lot of people jump because the movement of our muscles and our blood also moves our lymph. So that's why, after you get going for a little while with exercise, maybe your nose starts to run and other things open up. So that's the same concept and it's great for you.
So I think you can still get those mini trampolines, but I would also recommend getting that bar that you hold on to, like you would give a toddler to jump on,
Yes.
because it is easy to hurt yourself. So we've got about
Yes.
5 minutes left.
Yeah.
Tell me what you'd like to cover. Just go for it.
If just because we're still on exercise, I want to talk about the unbelievable benefits of it, but also from a perspective, I don't know if you guys have heard of late-term cardiac toxicity from chemotherapy drugs.
I do know that it can harm your heart, but I've heard of
Yes.
cardiac toxicity more from radiation.
Yeah, so it can happen from radiation, exposure to drugs like adriamycin, which is commonly prescribed. Herceptin can lead to longer term cardiac toxicity. There was a study in 2019 out of Europe that is showing us that exercise not only helps cardiovascular benefits, but has the potential to lower cardiac toxicity. And to me, that's just like, I've won the lottery. You know what I mean? Like, you can't even say how amazing exercise is, but it has to be tailored to the person, right? So what I think the only other thing that we didn't cover is safety for you, right? So just because we have these magic numbers of 150 minutes or whatever, right? Making it so that we're not, starting out jumping on the trampoline if you've got bad ankles or bad knees or whatever, and keeping it so that you're still, the CEO of your life, that you can take control of whatever you want. You can eat some ice cream if you want to, right? But making these changes with some steadfastness, with some consistency, that's really, Molly, what's going to keep somebody in cancer survivorship.
And so do you feel like some of the devices like Fitbits or pedometers help people track that, help them stay more on a routine?
Yeah, so it just depends on the person, right? So I have patients that do not want to track, they don't want to do anything, but they love community. Like just like how you guys took that walk, as a office team. I think the most beneficial thing, more than even a Fitbit, is almost to do like community competitions. Or I have patients that do like Fitbit groups, and they try to encourage each other to get the 10,000 steps that they want to, or things like that. But watching a number like that, or participating in these mini challenges that are just fun and promote that sense of community, that sense of belonging, that sense of a little bit of rivalry, tend to be probably the best places to be.
So here we are in time of COVID, this unprecedented time where people who are in treatment or just in recovery, their immune systems are depressed. So they really don't know where somebody might have been that they might want to be in physical community with by walking or running or whatever they do. So setting up maybe a virtual group is what you're thinking?
Yes. So yes, there's lots of online challenges that are out there. Even if it's just between you and a friend, it can just be like a nice way to kind of challenge each other, being like, hey, I got this many steps today. Yes. And exactly, Molly, especially when we don't have those physical areas and communities to do that with, helping each other through this difficult time, with these little check-in points, whether we talk on the phone or Zoom or whatever, is an excellent way to do it.
So how can someone get in touch with you? We've got 60 seconds left. What's the best way to find out about you?
Best way to find out about me is to go to my website. It's AIM Natural. That's AIM natural.com. Or you can send me an email personally to drdr.march, like the month, at aimnatural.com.
Perfect. So all these tips that Dr. March has shared with us will be available on our YouTube channel, as well as a downloadable from our website. And we look forward to speaking with you again soon, hopefully more about nutrition during and after treatment. So I just got a note. It says this was great information. So thank you again. Have a great evening. And everybody stay well, stay safe, sleep well, and exercise.
Yes. Thanks so much for what you do, Molly.
Thank you. Bye-bye.
Okay, bye-bye.